Good afternoon and welcome to our webinar, Providing CBIT via Telehealth, Consideration, Tips, and Tricks. My name is Angela Sullivan, Medical Project Specialist, and I will be your moderator this afternoon. This webinar is being provided as part of the Tourette Health and Education Program, a program of the Tourette Association of America in partnership with the CDC. During the webinar, we would be very happy to hear from you and include your voice in the conversation. You may ask questions or share comments using the question panel on the right side of your GoToWebinar player at any time. We will collect your questions and address them during the Q&A session at the end of the presentation. I would like to mention that funding for this webinar was made possible by our cooperative agreement with the U.S. Centers for Disease Control and Prevention. The views expressed by speakers and moderators do not necessarily reflect the official policies of the Department of Health and Human Services, nor does the mention of trade names, commercial practices, or organizations imply endorsement by the U.S. government. So before we get started, I just want to take a few minutes to share some information about the Tourette Association of America. Next slide. Here at the TAA, we are dedicated to making life better for all those affected by Tourette syndrome and tic disorders through efforts that raise awareness, advance research and understanding, and provide support. Next slide. Awareness, research, and support are the three main pillars of our organization, and through these we provide our community with many resources. Through social media, public relations, and news placement, as well as our youth ambassadors located across the country, we raise awareness of Tourette syndrome. This is also done through advocacy and lobbying on Capitol Hill for continued funding. By providing grants and fellowships to both young investigators and other professionals, we advance research and support clinical trials on Tourette syndrome and new treatment options. The TAA has a network of chapters and support groups across the country that provide support at the state level for their communities. In addition to this, programs at the TAA, such as online support groups, webinars like the ones you'll hear today, the biennial conference, and in-person presentations, we provide support to our constituents. With that said, it is my pleasure to introduce you to our speakers this afternoon, Dr. Matthew Capriotti and Dr. Christine Conelea. Dr. Matthew Capriotti is a licensed clinical psychologist and an assistant professor of psychology at San Jose State University. He holds his PhD in psychology from the University of Wisconsin-Milwaukee and completed pre- and postdoctoral fellowships in the Department of Psychiatry at the University of California, San Francisco. Recently, Dr. Capriotti conducted a clinical trial of in-home CBIT, funded by a clinical research training fellowship from the TAA and the American Academy of Neurology. He also co-led the Treating Tourette Together project, which brought together people with Tourette syndrome, their families, clinicians, researchers, and other stakeholders to set an agenda for the next generation of CBIT research. Over the last decade, Dr. Capriotti has published 31 scientific journal articles and 7 book chapters on Tourette syndrome, obsessive compulsive spectrum disorders, and on LGBTQ mental health. Dr. Christine Conelea is an assistant professor in the Department of Psychiatry and Behavioral Sciences at the University of Minnesota and a licensed psychologist. She received her doctorate in psychology from the University of Wisconsin-Milwaukee in 2011 and completed a fellowship in child mental health at the Alpert Medical School of Brown University in 2014. She has over 50 publications on the topics of tics, OCD, and anxiety, and her research in these areas have been funded by the NIH. Dr. Conelea currently co-directs the Converging Approaches to Neurodevelopmental Lab, which focuses on using dimensional approaches to study the causes and treatment of neurodevelopmental disorders, including tic disorders, OCD, ADHD, and autism. She also studies dissemination of evidence-based treatments and strategies for integrating neuroscience and behavioral methods to improve mental health. So without further ado, please go ahead with your presentation.
All right, thank you, Angela, and thank you all of you for tuning in today or watching later. It's really a pleasure to be here doing this with you all right now. What we hope is that this will be really helpful to a lot of folks as you're making an abrupt and probably pretty unplanned transition to providing telehealth in response to the COVID-19 crisis. But we also hope this will be useful more broadly as we go forward, whether it's in response to COVID-19 or whether it's just as part of a typical telehealth practice that you might have in the long run. So we're going to just brief, you can read them there. Neither Dr. Conelea nor I have any financial stake in any telehealth company. We both are involved in CBIT training, some of which are paid. We both do research and receive grants related to Tourette syndrome and other things. We just had our welcome message. What we're going to do is spend about 15 minutes talking about the basics of teletherapy. And then we're going to go into really spending the bulk of this talking specifically about how to do tele-CBIT, so how to do CBIT over video conferencing. So we'll do role plays, demonstrations, and then we'll have time for Q&A at the end. So I will present this teletherapy basics part, and we'll just kind of jump into that. Some disclaimers and context here. So this is meant to be a brief overview of tele-CBIT, or sorry, of telehealth. If you're new to providing telehealth, this webinar will not tell you everything you know to do it safely, effectively, legally, and in compliance with guidelines. What we hope this webinar does is orient you to the major things that you need to learn more about. Keep in mind that there are important differences state to state in telehealth laws, rules, and regulations. There are important differences agency to agency, hospital to hospital, so you need to be aware of those. We do have a resource list that has some more extended resources, things like webinars, practice pages from professional organizations that can help you do a deeper dive into these issues. And please be aware that a lot of these parameters are rapidly changing right now as we respond to COVID-19. Okay, so briefly, what counts as teletherapy? Some people will say phone therapy counts as teletherapy. That's fine. There are some specific phone therapy programs that you might have been aware of already. We're not going to focus that on that today. There are also online self-guided therapy programs. So think like a high-tech version of self-help. Those can be very effective for a variety of problems with folks who are able to use them in a pretty self-guided way. There exists such a thing for Tourette syndrome, but that's really not our focus today. What we're going to focus on today is doing live therapy via video chat, this kind of version of telehealth and teletherapy. So just some basic considerations. What platform, product, or system should I use? Typically, you must use a HIPAA compliant product, and we have a bunch of these listed on our resource list. These have certain security specifications and something called a BAA that the company enters into, which is related to HIPAA. So typically, you would need to use one of these specific platforms to be able to do teletherapy in compliance with all rules and regulations. However, during the COVID-19 crisis, HHS will now allow other platforms, and you can see their full announcement about this on the resource sheet. Things such as Skype, the regular version of Zoom, even things like Facebook video chat or FaceTime. So there are temporarily a wider range of options. See the resource sheet for more. And keep in mind too that policies in your state, in the agency or hospital you work in, or other policies may conflict with this HHS allowance. So please just be aware of your own situation and what is or is not allowed for you right now. Okay, what equipment or hardware do I need? Ideally, you have both the therapist and the client working on a computer. It can be a laptop, it can be a desktop. Newer is better, but really most computers made in the last several years will work just fine for this. One key thing is to think about using headphones when you're doing these sessions, because it's very common to have issues with audio echo. So definitely for you as the therapist, get some headphones that you're comfortable with. They can be wired where you plug them into your computer. They could be Bluetooth headphones where you can connect them wirelessly. And it's also ideal for your client to use those headphones too. Sometimes that may not be possible, like if you're working with a parent and kids simultaneously, but basically you want to make sure you have headphones, and ideally your client does too. For clients without computers, what's the next thing? Well, you could try as your next backup plan having them use a tablet like an iPad if they have access to one of those. That might be okay if it's compatible with the telehealth system you're using. As a last resort, you could have the client working on a smartphone. This might be better than audio only because it lets you see some video. However, it has some really serious limitations. One of those is that if a client's using a cell phone, they're likely using cellular data, not connected to Wi-Fi, and that can really not have the bandwidth to allow for clear video and audio. Also, the screen size is really small, so it prevents you from sharing text or looking at a same document with your client, and it means you're going to have a hard time. They're going to have a hard time seeing many of the details of their therapist on visual, which is really important, as we know, for CBIT. So it's kind of a last resort. Okay, what privacy concerns should you consider? We'll be brief about this. and you can learn more on the resources we have linked on the sheet. You need to think about privacy on your end as the therapist. So in many situations, especially if this is a planned telehealth situation, the therapist is in their regular office, a place where they have audio privacy and visual privacy. If you're now in response to COVID-19 doing this from home, try and be in a private space in your home as best as you can. You also want to think about and discuss with your client privacy on their end. So planning ahead for an ideal environment. So ideally, this is something like where they're in a separate room. Maybe it's a spare bedroom, maybe it's their bedroom in their house, but a separate room where they can shut a door and have privacy to talk with you and meet with you as their therapist. Sometimes this is feasible, sometimes it's not if you're living in a home that's more crowded. So what you want to do if it's not is problem solve to just get the most privacy possible and then just make plans for how you're going to navigate that. A really important part of this is informed consent. So if there are in the current moment limitations on your own privacy as a therapist, you want to discuss those. And if your client has a limitation on how private a location they can be in, just make sure you're talking through that and coming up with some sort of plan if they do need to speak more privately, or maybe you can connect another way, like they could, make a phone call from their yard or their car or something like that. A big part of telehealth success is planning ahead with your clients. And this happens before you start what you think of as your therapy session or your real clinical session. So when you're starting a client on telehealth, you want to send them instructions on how to download software for the platform you're using, how to create an account if they need one, and how to log into sessions. We won't have time to get too heavily into how to craft these instructions, but an important part is to use the help pages and the IT resources of the platform you're working with. So you do not need to create your own very, very, very detailed instructional guide. You do need to create kind of a list of steps for clients and then link them to the appropriate help pages on whatever that platform is. An ideal thing to do is to have them do all this, download it, get set up, and then do like a 10-minute equipment test or a dry run before your actual session. And this is where you and your client connect briefly just to make sure you can see and hear each other and you know what to do for your quote unquote real session. If everything works great at this point, awesome. You just say, all right, see you for a session in a couple of days. If it's not though, that's where you can refer them to customer support to troubleshoot what's going on before your real session if you need to. If you're comfortable, you can try and problem solve with them, but most of us are not experts in the platform you're using. And what you want to do is refer them out to the customer support for that platform. I would also mention if you work on a clinical team, this equipment test can be with someone who's not necessarily you as the therapist, as long as they are have a role that is client facing and appropriate. For you planning ahead and for your client, plan for uninterrupted time. So do a little problem solving ahead of time. If your client is, let's say a parent at home with the kids, how can they set their kids up doing some activity in the next room over? So they are likely to mostly be kept busy and safe while mom or dad is in the next door if they need something. If you're working with a parent and a teenager, and maybe there are younger siblings at home, planning ahead for what's the plan for keeping those younger siblings occupied during your session, this kind of thing. Frankly, it's rare that you will have totally uninterrupted time. Younger siblings need things. They'll come in and ask mom for something. If there's a dog at home, the dog might bark and the mom and whoever your client is might need to go deal with that. But what you're doing is planning so you can get as much uninterrupted time as possible. Also really important to have a backup contact plan. So if either on the front end you have trouble logging on for the session, or if the internet drops out or the call drops midway, what's your backup plan for touching base with your client to troubleshoot, or at least to say, okay, we need to do more work. This session isn't going to happen now. When can we reschedule for? The best backup plan is usually just to have a cell phone number for your client and a plan for calling them if the internet call drops. What about liability and safety? Again, a lot to consider. Check out the resources on the resource sheet, but just an overview here. You need to discuss and document informed consent considerations that are specific to telehealth and specific to the use of email. And our resource sheet has specific forms and checklists for this. So just know that even if you're working with a client who provided informed consent for in-person therapy, you need to go and discuss some specific considerations related to informed consent over telehealth. You need to be aware of laws, rules, and regulations that dictate where you can practice. So if you're licensed in a single state, there are going to be very specific laws, rules, and regulations about where your clients have to be. Typically, your clients or patients have to be physically in a state where you're licensed. There are some limited practice exceptions in certain states. So just be aware of what these laws are for you and for the clients or patients you're seeing. Typically, we say to avoid using telehealth with clients who are at more than minimal risk for safety issues. However, in the current moment, many of you may find yourself working with clients who have significant safety issues that are ongoing, and now telehealth is your best bet for serving them. It's beyond the scope of this webinar to go into the details of how to do that here, but it is really important to come up with a detailed safety plan with your clients, a detailed safety plan with these clients in advance of a crisis. So just once you're moving to telehealth, or to update your existing safety plans based on how things are now. And of course, as always, document your safety planning, your safety concerns, and your safety assessments. Considerations about reimbursement and billing. Again, something that's super in flux and will be different from person to person, practice to practice, state to state, but some general things. Think about your informed consent for fees. So most folks set their fee the same for telehealth as in person, but you want to have in advance informed consent about what is your policy, for example, if a call drops midway through. What if your session drops out 3/4 of the way in? What's the billing situation there? What about half of the way in? What if it's just a few minutes in, like 10% in? So think about these situations and just be clear on what the policy is. As far as insurance reimbursement, many insurance companies are now temporarily allowing billing for in-home telehealth. Again, this varies insurer to insurer, varies on different situations, but it's just something to be aware of. So if you looked into this maybe a while ago and you found that an insurance company wouldn't bill for telehealth, worth considering revisiting that. Specific billing codes do vary across, provider setting, type of practice, like if you're a psychologist or an OT, but it's often the case that they're the same codes as in-person interventions, just with a telehealth modifier. And the resources on the resource sheet will help you get acquainted with where to look for that information as it relates to your practice. All right, so at this point, we're going to move into talking about some specific considerations on how to do tele-CBIT. So this is where we're really going to dive into what does CBIT look like on telehealth and what's important to consider. As we do this, you're going to see us rearranging some things. So if the window drops out, just bear with us where we get the right setup. So we're going to walk through individual components of CBIT. So the first one is going to be related to psychoeducation and treatment rationale, things that happen in that first kind of true CBIT session. So typically this is a back and forth conversation where you're presenting some information to your client and seeing what they think, checking their understanding and seeing what applies to them. And you can of course still do that on telehealth. One thing that comes up is that we often in person, we might show worksheets or pictures or things like that to a client. So often what you want to do to make this happen, and you'll see me do this in a way, when I role play this with Christine, is to use the screen sharing function on your telehealth platform so that you and your client can see a worksheet together. Some of these platforms will also have an option where you can draw on your screen, like if you would typically do that. So just get to know your platform. An alternative to this is that you can use simultaneous editing software. So you could work, for example, on a shared Google Doc or a shared document in Dropbox. And that really, I would say, is good if your client is already someone who uses Google Docs, maybe at work or maybe for their schoolwork, or uses Dropbox, whatever one of these softwares are. This can work if a client already is oriented to those and if you're comfortable as the therapist with it. But my default is usually just to use screen share to show them things at the same time. For this, you're going to want to use pre-prepared worksheets and documents, so the same kind of things you would show in person. And what we'll do now is just briefly role play what some of this will look like. So what I'm gonna do is bring up this picture of a brain. And so right now you're seeing on my screen just this picture of a brain. This is not, I did not load on a specific worksheet, but this could be anything. This could be whatever worksheets you typically do to teach about Tourette syndrome or to go over things. So what I'll do now is I'll role play with our brave volunteer client, Dr. Conelea. I will role play just how we would do this. So you'll see her be the client and me act as the therapist.
As a quick disclaimer, I will say I do not have tics. I'm going to be modeling what they would look like in session.
Thank you. All right, so as we're doing this, I'm going to stop showing my screen, but right now you can see, here's the worksheet that I'm working with. So let's imagine we've been talking, right? All right, and now I'm gonna we're gonna start at the part where I would talk about what in the brain causes tics. And I'll just show you how I would do this. Like, all right, Christine, so has anyone ever talked to you about, like, any doctors or your parents or anyone else, what happens in the brain when tics happen?
I mean, my doctor said that my brain makes them happen, but I don't really know like what's happening in there other than that it's my brain.
Yeah, so it's your brain and something ticky is happening in there, right?
Yeah.
So it turns out what happens in folks who have Tourette syndrome or folks who have tics is that your brain has a natural brake system. So it has brakes like a car. And normally in a car, like when you ride in a car, where are the brakes that the person driving it pushes?
Your foot.
Yeah, you hit them with your foot, right?
Yeah.
Well, your brain has brakes like that too. Your brain has a really fancy name for those brakes. The name of the brakes in your brain, the fancy name is the cortico-striato-thalamocortical loop. Whew, what a name. That's your regular brake system. So I'm going to show you a picture of the brain.
Okay.
So you can see their screen. And do you see this picture of the brain come up that has some of those words?
Yeah.
Yeah. So what happens is you see the part, the kind of bluish part on the left where it says prefrontal cortex.
Uh-huh.
So what happens is that is over there. That's going to be some of your emergency brakes, but right behind there, there's a part called your motor cortex, like a little in the pink part. What that does is that makes all the plans for different movements and signal and sounds that we can make. And our brain is shooting out a bunch of these all the time. And it's sending them down to the striatum. The striatum is the part of your brain that's the regular brakes. So it says, whoa, 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 I don't want to do that now. I don't want to do that now. I don't want to do that now. And it only lets through the movements that are appropriate or that you want to do in the person in that moment. So
where's that part? Is that's like that? I think I see like that green part. Okay.
Yeah, that's that green part. That's the striatum. So
okay.
Do you think for you, are you 100% of the time, are you just doing all the movements? Are you doing all the things? Like at any time, are you doing 7 different things?
No, like I try to do
Yeah.
just one thing at a time.
Yeah, you're pretty much just doing one thing at a time, right? So is it fair to say that you probably have these breaks? Like they're probably there, you don't have a hole in your brain where these breaks would be?
Yeah, I can, it's hard to stop my tics, but I can stop myself from doing other stuff if I.
Yeah, exactly. So we know for people with tics that they have this part of their brain that it mostly works, and it probably works about 90% as well as it does for people without tics. So it gets like an A minus. That other 10% is that some movements and sounds slip out,
Okay.
and those 10% are the tics.
Okay.
You also have an emergency brake system in your brain that goes from, and I'm going to stop this here. I'm going to break the role play just for time so we can do this. But what you can see is we're just using this picture to have the same kind of conversation that we would in person. I'm going to pause my screen there. So coming back to the slides, So again, this is really a similar thing. You just want to make sure that you have this screen sharing function happening. And if you have questions, we'll take them at the end about this. Another thing we'll demonstrate is creating and updating the tic hierarchy. So this is your list of tics that you came up with in one of your first sessions. You probably discussed these tics in the assessment, and what we'll model here is how to use a prepared form that you prepare yourself as the therapist to create that together with your client. So what I'm going to do is, again, use my shared screen function to show that document that I'm working with on my computer to my client. And you'll notice where, even though I'm doing the writing, I'm being really collaborative and getting my client, Christine, to generate the information there, just as I would in a session. So we'll go ahead and role play this, and I'll keep my screen share and I'll pull up this prepared form. All right. And I would just note too, before we get started here, you need to be mindful of complying with copyright laws on this. So as you're doing this, make sure that if you're using an online form, you have purchased the corresponding physical thing. The idea is not to promote people just using forms and breaking copyright laws here. But if you do have that form and you're using it in the same way, and if your client has the workbook, this is a way you can collaborate on the same documents using what you purchased, and you're using it within your own use. All right, so jumping right in past that part. All right, so Christine, do you see here this kind of list? It says on the top, tick symptom hierarchy tracker.
Could you, kind of small for me, can you make it a little bigger?
Yeah, let's see if I can zoom in. So is it a little bigger now?
Yeah, that's better, thanks.
So what we're gonna do here is make a list of your ticks and then keep track from 0 to 10 how much each one of them is bugging you. And we're gonna do it for two reasons. First of all, we wanna do this because we wanna know how much each tick is bothering you, not other people around you, not how big it looks, not anything of that. Because what we're gonna do is only work on the ticks that bug you. And we're gonna use that as our guide. So if a tick doesn't bug you, even if it bugs your mom, we're just gonna work on the ones that bug you. That's one reason. Another reason is that we want to keep track over time. When we work on ticks, do they start to bug you less? That'll tell us if what we're trying is working. All right. So last time we talked about a few ticks that you have. One of them you said was a sniffing tick. So I'm going to write that here. The other one you said was it involved your arm. What do you want to call that one?
I guess my arm lifting, arms jerking, snapping.
Whatever you want to call it. Yeah.
Let's just call it my arm tick. I'll know what we're talking about.
Okay, arm
tick. Yeah.
Okay, and is that the only arm tick you have?
Yeah.
Okay, cool. So arm tick, we'll know what you're talking about. And then you said you also have kind of a fast blink like this, right?
Yeah, fast blink is a good one. Yeah.
All right. So what we want to do, today's session 1, and we'll write today's date. And what we want to do is put a number for each of these, thinking about, like, in the last week or so, how much does each one bug you? So you can give it a number from 0 to 10. A 0 is that it doesn't bug you at all. Like, you totally do not care that it's there.
Okay.
And a 10 would be that it bugs you kind of as much as you could ever imagine any tick or something like that bothering you. So it bothers you for a lot. And then, of course, you could have numbers in the middle. So what number do you think you would give the sniffing tick for how much that bugs you?
Like for how long, like how much it's been bugging me for ever since it started, or just lately? I'm just confused about that.
Just lately, like this week.
Okay. Yeah, it's been kind of bothering me, but it's not terrible. It doesn't happen all the time. So I'd say maybe in the middle of 5.
Okay, a 5. So kind of bothering you. You wish it weren't there, but it's not super duper like the worst that it could be.
Right.
Okay. How about the arm tick?
Yeah, so that it doesn't happen that much, but when it does, it's really annoying because it makes it hard for me to type on the computer or write and stuff. So that one's probably more, maybe an 8. It's kind of bad.
Right on. So that makes sense. So it's an 8. Like, you notice, even though maybe it happens less than some other ticks, there are some important things where it gets in the way, and that really bugs you.
Yeah.
That makes sense. How about the fast blink?
That one's not super bad. It's but it's not 0. So let's do Can I do like a 2 or 2.5, something like that?
Ooh, you want to do a 2.5 or a 2?
A 2.5. Yeah.
All right, a 2.5. Excellent. So let's look back at this and make sure we're getting this right if we put them in order. So would you say that out of these 3 ticks, the arm tick is the one that bugs you the most?
Yeah.
And then sniffing is after that, and then fast blink is in 3rd place.
Yeah, definitely.
Okay, cool. Well, that all makes sense. And what we're going to do now is figure out what tick to work on first. So in most cases, it's always going to be up to you. So you can say no. Like, you can really tell me what you want to do. But in most cases, it's helpful for a person to start with the tick that's bothering them the most. So in most cases, and that's because it's going to be one that'll just be a good starting point to work on, and it's at the top of your list. We don't want these ticks to bug you, so we want to start with the ones that bug you the most and get you help with those as soon as we can. So what do you think about starting with the arm tick?
Yeah, that sounds good, especially because I have to do like a lot more stuff on my computer lately, so it makes stuff hard. So that would be good to work on.
Yeah, so it'd be super helpful like right now as you're doing all this computer stuff.
Yeah.
Okay, cool. So we'll do that. And I'm going to break out of this role play now. I'm going to pull the slides back up. So that's creating and updating a tick hierarchy. Once we picked a tick to work on, now we're going to move into awareness training. So we're going to do awareness training, competing response training, and social support, the core parts of the habit reversal chunk of CBIT. This is where things start to get a little complex, but still doable. They're just some special considerations. So, and this is where when people think about doing tele-CBIT, they have the most concerns, right? To do this, you really need to see your client in a lot of detail. And you really need to be able to notice subtle movements and sounds, and you have to be able to catch things quick. So a couple of things you'll see happen as Christine and I work on her arm tick. One is that you need to be careful about how you're positioning the client and yourself. So this is going to involve us moving around. You also need to consider that your client on many platforms can see their own video feed. This can help as you're doing response description. They can watch themselves do the tick, but it can also just be distracting for some kids. So you just need to consider that this is an option that might be on. You can use it in a helpful way, but you might notice that some clients are getting distracted. So it's a feature that you should be aware of and know how to help folks turn on and turn off if possible. Okay. Another thing is that when we're doing response detection, which I affectionately refer to as the tick catching game, once we've described the tick and we're trying to practice catching it in real time, what activity do you do? So our default activity for doing this in face-to-face therapy is to have a conversation about some topic not related to ticks. So maybe, a sport the kid likes to play, or for an adult, what they're going to do that weekend, or a hobby they have, whatever. Something not related to ticks, that we just talk about that, have a back and forth conversation, and then practice raising our hand when one of us notices the tick. That works great if you're going to do that. But you might, in person, you might find that that doesn't work well for a certain client, or they're not interested in that so much, like if they're younger or something like that. So you can think about some alternatives. These are just some ideas. One alternative might be to have your client play an online game while you do this, or have them watch a YouTube video on their end, and then you're still both playing this tick catching game. I've done this before on telehealth and in person, where maybe I'm giving a kid a fake spelling test so they can practice in that kind of situation. You can be creative. Just think ahead of time, are you going to go with the default here, this back and forth conversation, or for this particular client, are you going to need to figure out something else? What you'll see Christine and I role play is doing this with the default, just a back and forth conversation. All right, so I'm going to break out of this. And we're going to start with response description. So you'll see me pull up a sheet that we'll use for response description. So what I'm going to do here, you'll see as I go through with Christine, is we'll write the name of the tick, a definition, and a tick signal. So this is just how we would do response description normally. So we're going to break into the role play now. It's like, all right, Christine. So now we're going to get started working on that arm tick.
Okay.
We just call it arm tick, right? That's what we should be talking about. Okay.
Yeah.
All right. So the first thing we're going to do, I'm going to write down on this sheet here that we're both looking at. The name of the tick we're working on is arm tick. And what we're going to do first is come up with a ridiculously detailed definition of that tick. And the point of that, it's not just because I like to be annoying and ask a million questions and come up with a bunch of details. The point of that is to really get to know this tick so that when we talk about strategies to deal with it, you can use those strategies every time, because you're going to be a pro at knowing when this tick is happening and knowing and catching it really early too. So part of what we want to do when we do this is have you demonstrate the tick, like do it on purpose a few times, and then I'll do it along with you and we'll try and figure out what's happening. So right now, can you show me what that arm tick looks like?
Yeah, it's kind of like, can you see that?
Yeah, so I see kind of your arm moving, but I can't see it all. So what I want us both to do is scoot back a little bit and adjust your camera if you need to, so that both of us, we can see like the whole arm. So right now, when you look at me, can you see my whole arm?
Yeah.
Okay, I'm actually gonna adjust it even a little more. Yeah, and I can see, oh yeah, I can see your whole arm there. Can you scoot back a tiny bit more?
Yeah.
Okay, cool. Yeah, so now I can definitely see your whole arm. All right, so I want you to just show me a couple times what that tick looks like when it happens normally.
It's kind of like this.
Okay, your arm kind of comes out like that.
Yeah, my left arm, like it's my right arm pretty much all the time, I think.
Okay, it's the right arm pretty much all the time. Okay.
Yeah.
Now what we want to do is okay, I see that. So I see your arm coming out. Yep.
Yeah.
What we want to do is try a slow motion version of that. Can you show me in slow motion how that looks? All right, so I see that arm coming out in slow motion. Great. What I want you to do now is start telling me, we're going to come up with a really detailed definition of this tick. Tell me the first thing that you think moves when you do this.
I feel like it probably like my elbow, and then I can like my hand sort of leaves my lap if I'm sitting down, or like if I'm on the computer, it kind of goes like that.
Okay, so we've got the elbow moving, and it looks like it's moving out away from your body, right?
Yeah. Yeah.
Your hand comes, is it up towards your face?
It kind of flicks out at the end. Yeah, it doesn't go like that. It's more like that.
So it goes out at the end. So your elbow comes out. When you look at your
like my elbow comes out, and then like my forearm kind of snaps forward, and my hand just kind of like my wrist will flick.
So elbow comes out, and then hand comes up with it, and the forearm snaps forward, and your wrist flicks.
Yeah. Yeah, and
okay.
So, like sometimes I think my left elbow kind of like goes out, but it doesn't really like do the whole thing like once in a while it'll be my left arm, but it's usually like that.
Okay, so let me try writing down what you just told me on this sheet here. So you said the first part was that your elbow moves out away from body.
Yeah.
Mm-hmm.
Yeah.
What does your hand do? What does your hand do while that's happening? Where does your hand move?
It kind of it doesn't really like tense up. It just sort of like hangs, and then flicks. It's almost like my elbow snaps, so my hand like kind of flicks with it.
Okay, so hand hangs, then elbow snaps, and hand goes. Where does the hand go when the elbow snap happens?
It just kind of flicks to the side and then comes back down.
And hand flicks to the side, then comes back down.
Yeah.
All right. So is this like, if we were going to use this as an instruction manual, does this tell me how to do the tick? Like if I do, my elbow moves out, then my hand hangs, and then my elbow snaps, and the hand flicks to the side.
Mm-hmm.
Do you think that's tick?
Yeah, the only thing you're missing is like how sometimes my left kind of.
Okay. Sometimes left. So sometimes, what happens with your left arm sometimes?
Like my elbow comes out.
Okay, sometimes left elbow comes out. Okay, great. So what we're going to do now is we're going to Practice catching that tick when it happens. Oh, but we got to think about something else first. My bad. So that's a good definition of the tick. Do you get a feeling that tells you that tick is going to happen? Like, can you tell it's going to happen before it does?
Yeah.
Yeah. And
I
what, I know this is tricky. Is it a feeling in your body?
yeah.
Okay.
Yeah, it's like I feel like this tension kind of in my arm, like around my elbow. Like it just feels like something like energy sort of that has to come out.
Yeah. Okay. So there's this feeling like energy and elbow. We'll just
Yeah.
say that for the tick signal. Okay. So now we're going to do something that I call the tick catching game. What we're going to do is we're going to have a conversation not about ticks. So you can tell me about all the fun things you like to do in Minnesota during the summer. You can tell me about playing a sport you like. You can tell me about something cool you did at school, whatever you want to talk about. But while we're doing that, I'm going to want you to raise your hand. I want you to raise your left hand because this is the hand that the tick happens with. Every time you feel that urge, you feel that funny feeling, or every time the tick starts to happen. Your job is to catch it as quick as you can.
Okay.
So I want you to do that, and I'm going to pay attention too. And if you catch one, I'll say, "Hey, nice job." And if you miss one, I'll say, "Oop, remember." I'll point it out to you. Okay.
Okay.
All right. So what do you want to talk about today?
I guess we can talk about you brought up stuff in the summer, but I do a lot of winter stuff too, because it's winter most of the time in Minnesota.
Yeah, it's winter most of the time in Minnesota. Okay. So tell me.
I kind of think I felt it there. Was I supposed to? Yeah. There was
Nice catch. Yeah, you got it. Great. So winter in Minnesota. Tell me about what you do. Oh, there's one.
Oh, I missed that one. I learned how to cross country ski this winter. So that's
Wow.
yeah. There's like a golf course by my house, and they plow it in the winter for there's one there.
Nice catch.
They plow it for skiing, so I just try to like walk down there. So I learned how to do that this winter, which was pretty fun.
Wow, cool.
I think I felt the urge there. It didn't happen, but I felt it.
Yeah, you got it before your arm moved. Awesome job. Well, so we'll break this role play. I could talk to Christine about cross-country skiing all day, but we will stop for time. And I will go back to just orient back to the slides. So hopefully what happens here is this feels pretty similar to doing it in person once we get everyone moved around in the right spot. You may be thinking, oh my gosh, what if it's a foot tick, or what if it's this? There will be times where you do get a little limited, but generally, in my experience, you can problem solve pretty well with any tick from the waist up, and then you just need to be a little creative with positioning and stuff with other things. Okay, so competing response training, this part is really going to be similar to awareness training. The same considerations. You need to have full view of your client. You want to come up with that competing response, then you want to practice it in the same way. So we'll do this really pretty briefly. We'll go ahead and do that briefly just for the for this arm tick. And what I'd be doing is keeping track of that competing response on the same sheet using the same kind of skills we talked about before. Right. All right, Christine, so you're a pro now at catching this tick while it happens, and you were even catching a bunch of them before they happened.
Mm-hmm.
By the way, I would actually do awareness training longer until she was catching 80% of their ticks, but we're just speeding it up here. So what we want to do now is come up with what some people call a competing response. I just call it an exercise, or I heard some kids call it a tick buster. And it's going to be something you do to stop that tick in its tracks when you feel it starting. So this is going to be something you do as soon as you can when you notice the tick.
Okay.
You're going to do it when you feel the urge coming, or in the middle of the tick, or even right after the tick happens. So every time you tick, as soon as you can, you're going to do it for 1 minute and then keep going if the urge is still there. There are three rules about it. It needs to be something that stops the tick from happening. It has to be less noticeable than the tick. And it needs to be something you can do in any position for a minute. So anything come to mind, like an exercise you could use to bust that tick?
I like probably you said opposite, right? So like opposite would be somehow like keeping my elbow in to my body.
Bring your elbow in. Yeah, and can I ask you to scoot back again so I can make sure I see your hand the whole time? I'll do it too. Keeping your elbow in, great. And elbow in, is there, your hand was a part of that. So do we need to add a part on for the hand?
Yeah, I don't know, like is it better I could do something like this or I could go like that.
Do that. Okay. So let's think about this one. Your elbow's in and your hands are like this. Does this stop the tick from happening?
Yeah.
Okay. Is it less noticeable than the tick?
I mean, yeah, I feel like I don't really do this very much, so it might feel kind of funny. Like I feel like this like feels a little more natural to me sitting like this.
Okay, so this feels a little more natural. And what I see you doing there is your elbows in and then your hands are together with your fingers interlocked.
Yeah.
Okay. Let's see if you can do this. So does this stop the tick from happening?
Yeah.
Like while you're doing this, you can't. Like
Yeah,
I'm trying to hold my hand up and do that tick and I can't.
yeah, I like it would be uncomfortable, but I could do it, I think.
Yeah, so you're right. This will feel a little different at first, and it's in that urge is just going to be there while you do it. So it won't be comfortable, but we just want to do something that you can do it. So you can do this.
Do I get like that, like tight, or should I?
Oh yeah, so I see where you do. I tell you like really tensed up. It's
Yeah.
okay if you press into it a little. So watch me, right? I'm pressing a little into my legs. This is me resting. This is me pressing. But
Okay.
I'm not like that. See how when I do that, I think it's really
Yeah.
tight.
Yeah. So just like a tiny bit. Okay.
Yeah, like kind of lean into it. Good. And so this stops the tick from happening. Is this less noticeable than the tick?
Yeah.
Yeah, I think so.
Yeah.
And let's see, can you do this in any position? So can you do it sitting? Can you do it standing? Let's try. Let's stand up. And I'm going to adjust so I can see. All right. Okay, so you can do it standing.
Yeah, that would be fine.
What if you were sitting? Let's sit back down. What if you were sitting and you had to write something?
Can I scoot up to my desk? Okay. Yeah, that feels pretty. Like I could just go like this.
Okay. So that
It's
one might
not
work.
like against my side, but I can keep it like on the table.
Okay, so you can mostly
or I could
do
do it on my lap. Yeah.
Oh, okay, doing it on your lap.
Yeah.
What if you had to pick one hand up to write? What would you do with your other hand to keep going?
Maybe I could like just keep it like this and just can keep my elbow down while I'm writing.
Okay, kind of a backup plan. I wonder, is there a way you could do with your other arm? Is there a way you could do the parts you're doing before your elbow in and your hand kind of on your lap?
Oh, yeah, I guess I could hold it in and on my lap and then just have this on the desk.
How does that feel? I mean, you're the boss, so if that feels worse than what you were trying.
Sorry, I have a call coming. I won't answer it though.
Oh, awesome. Yeah. Thank you. Good call.
No, that feels fine. Yeah.
Okay, great. Great. So let's go ahead and write down that competing response or that exercise or tick buster. What should we write down here? You tell me. Oh,
elbow, like glue elbow to my side, interlace fingers on my lap.
Interlace fingers on my lap. And then does that mean also, so your hands are in your lap?
Yeah. And then we could put like, or like if I'm writing, just one in my lap.
Or if writing with one, other is in lap. All right. Yeah. So let's call that kind of done for now with that. Realistically, if I was working with Christine on this, I might want to drill down a little more on refining that, right? I might want to explore having, interlaced versus is it helpful to have her hand on her thigh like that? But you can see how this process works over Tele, which is kind of the main thing we're going for here. All right. And just for the sake of time, so we have some time for questions, I'm just going to talk briefly through these other points. So we would go on, we would practice the competing response, really similar to how you saw us practice the awareness. For social support, where you're talking through the reminders and praise with the parent and the support person, or sorry, the client and the support person. Just a consideration here is that you're going to need to move them around so you can see both of them in the screen. So if you have, I'll just show you with me, and now I can't see myself, right? So you might have your client kind of back up so their parent can scooch in there. Ideally, you see both of them on the screen together, just because you would want to see both of them in session. But if it's not feasible, it's not feasible. You don't have to do things like, 11-year-old kids sitting on parents' lap for the sake of seeing them. Just use your judgment. Progressive muscle relaxation, briefly, this is complex. You may have some challenges in seeing tension and relaxation as well on the video as you would in office, just doing the best you can. One trick that happens is, particularly if you're having people close their eyes, it can feel really awkward for your clients to stare directly into the camera while their eyes are closed and you're watching them. So sometimes it can be helpful in making this a little more natural, just for both of you to orient kind of diagonal like this. You would want to have them back up so you could see their body, right? So they're backing up, and then have them orient sort of diagonally so it doesn't feel like you're staring at each other. And then you as the therapist can also be oriented diagonally, but then turning your head to monitor them. So you just want to play around with it, but those are some basic ideas. Really briefly, just a moment talking about Tele-CBIT research. We have 3 studies on Tele-CBIT, studying how it works. 2 of them are published. One of those is in preparation. I was the lead on that study. All the data are collected. It's going to be coming out soon. Basically, each of these 3 studies has shown that telehealth can be effective, and Tele-CBIT in particular can be effective. So you can see these there and look at these papers if you want. One study by Himley and colleagues in 2012 compared Tele-CBIT to in-person CBIT, and this was Tele-CBIT from clinic to clinic, so slightly different, but they found similar results for people getting Tele-CBIT versus in-person CBIT. Ricketts and colleagues compared Tele-CBIT to a wait list, and they found that for youth, both the Himley and colleagues study and the Ricketts and colleagues study were with youth. They found that Tele-CBIT was better than a wait list. The study I just ran looked at youth and adults. It suggested that doing Tele-CBIT in the home is highly feasible, and a majority of both youth and adult clients improved. So there is reason to think from research that this is a good idea to try, is feasible, and can work well for folks. Some just general thoughts before we open up the Q&A. So allow for a learning process for you and your clients. A lot of people, when they start doing telehealth, feel pressure to seem like a tech expert, to feel smooth and to feel polished right away, and to be able to support their clients, to get where their clients immediately feel comfortable and super at ease. That may not be realistic. What is realistic is setting the bar for yourself at, can I have this be an effective learning process where I get myself pretty up to speed, but keep learning with clients? And I'm an effective guide in helping get my clients up to speed and working this process together. I feel this way, even though I've now been doing telehealth and Tele-CBIT for 7 years, there is still a process where I don't, even though I feel pretty skilled when I start out doing telehealth, I'm going to be learning with that client. I'm going to be learning what works with that client, and I'm going to be supporting that client getting more comfortable as we go. Be creative, be flexible. So all the things you would do as a therapist to be your creative, flexible, captivating self, all of those things that you would do in person, try and bring that same spirit to your online work, to your telehealth work. One other thing to think about at our 3rd point here is a lot of times when people are starting telehealth and Tele-CBIT, they want to set the bar. Their gut is that they want to make this feel the same, or their worry is that this is never going to feel the same. And I think that's right. It's never going to feel the same. Like, I don't feel the same talking to my clients or talking to my friends on a video chat as I do sitting in a room with them. It's just different. The thing to think about clinically that I think is a more helpful focus is, how can we have the same kinds of things happen in session? How can we accomplish the same goals? How can we work the same therapy process even if like the eye contact feels a little off, or even if we wind up interrupting each other or problem solving some tech stuff, that kind of stuff. And I think the last point is related. It's really to consider rapport and alliance. So people are often very concerned that they will be less able to build or maintain a therapeutic relationship on telehealth. And because things like, you know, the eye contact is different, like just the feeling is different, people might be a little more reserved. Those parts are true. But you're also going to have opportunities in this to build a strong rapport and to build a strong alliance with your clients. So this might even be directly related to telehealth, where you're going to help them patiently through some of the process. And they're going to show that you are like kind and compassionate when you're helping them work through these steps, or that you're being patient as they're figuring out tech stuff. They're gonna see that you are working really hard to be a good therapist to them, that you're adapting to health, even if you're not an expert, even if you're running into some bumps. And they're gonna see that you're doing your best to be creative, patient, and really support them in moving toward their goals. So just remember, yes, there will be things that feel different interpersonally, but you also have opportunities to really show that you are right there with them and really supporting them in this telehealth environment, and especially if that's an unplanned telehealth environment that you're doing right now in the current moment. So with that, why don't we open it up to questions and go from there?
Thank you both so much for an excellent presentation. So as Dr. Capriotti mentioned, we're going to begin answering the questions that were submitted during the presentation. As a reminder, you can still submit your questions through the question pane in your control panel on the side there, so please do so. I also do want to mention that both the PowerPoint slides and the resource list that was referenced earlier in the presentation are in the handouts section on the control panel on the side there, so you can have those and access them. If we are unable to get to everyone's questions here at the Chart Association, we do have a full-time information and referral staff who would be happy to answer any questions that you have. And you can also email us at support@tourette.org or give us a call 1-888-4-TOURETTE.
Okay. Angela, can you let me know if you see any questions on your end?
Yes, I see a handful here.
Okay, can you ask them for us, please?
Yes, of course. So let's see, any tips for a less compliant or a more complex patient, such as ADHD?
Yeah, so I can take this one. I think trying to translate the kind of things that have worked in session for that client. If you have kids who tend to be easily off task, easily sidetracked, more impulsive in session, think about translating whatever you're doing to manage that behavior for telehealth. So for me, that's bringing in some structure where we're going to have some setup where we're going to work for 20 minutes. And if they work well for 20 minutes, we're going to play for 5 minutes. And those times might be adjusted based on the kid's age and what they need. So I'm going to do something like for that kid where normally we have that set up where after 20 minutes we can play a game. I'm going to say at the front end, like, all right, so first we're going to work for our 20 minutes together. And if you do these things while we're working together, if you answer questions when I ask them, try your best to do activities that we talk about together, and stay in your seat unless you ask me to get up. If you do those 3 things for 20 minutes, we're going to do something fun for 5 minutes. Our options for doing something fun are, maybe it's playing this online tic-tac-toe game that I found. I would look that up ahead of time. But you know what, you could also like find something cool in your house and like something cool from your room that you want to show me, and you could spend 5 minutes showing me that. Or you could even introduce me to your dog or your cat for those 5 minutes. So that same kind of thing that I'm going to do in session, I'm going to bring that online and think about how to make that work in this. And sometimes it doesn't work, right? That like they're definitely like, if you have a client in mind where you're like, no way is that working, like, yeah, I can't tell you that it's magic, but the strategies are, it's just about bringing those same strategies in online.
And you can leverage the technology itself. So doing things like watching a YouTube video together, or having them show you what level they're on a game on the computer during the session, or playing like their favorite music together during it. So thinking about using the technology itself as a reinforcer.
Great. Okay, so the next question that I have is, what if a client believes that the competing response can be just as ineffective as the tick itself? I have had a child in the past that has mentioned this concern.
I can take that one. So a lot of clients are hesitant when they first hear our rationale for the competing response. I think it sounds like it's like sort of deceptively simple. So what I usually try to say around that is that it's going to feel different, it's going to feel awkward, and that I want them to just see if they're willing to give it a try. And so trying to problem solve with them a competing response that feels really comfortable, just like you saw Matt do. He gave me a lot of different options for how I could use that. And then seeing if they can agree to giving it sort of a trial period. I think that makes it feel a little easier to people to know they're going to try it on for size. And I encourage people to come back to me with, I want to know every time it felt like it didn't work. I want to know how to problem solve with you to get it there. So fostering that openness that you're willing to hear what's not working can help get you to a place where you can troubleshoot something together that does.
Yeah, and I would add with that, like even like that's just super important also, because if you don't have a competing response the kid is willing to do, none of this is going to work, right? Well, none of the habit reversal piece, the functional piece might.
Wonderful. Okay, so the next question I have, it's a little long, so just bear with me. So thank you both for helping so many of us make this abrupt transition to TeleCBIT. Our organization is working hard to get video visits up and running, but we're just not there yet. Right now, I'm still meeting with families over the phone. I've been trying to hold off on meeting with new CBIT families until the video platform is up and running, but some are really wanting to start as soon as possible. Do you have any recommendations for a reasonable place to begin with CBIT if we only have phone available?
Yeah, so I think this is tricky. I think, so what I'm about to say is just purely me thinking off the top of my head. I think it's really hard to start with habit reversal, like the awareness, competing response, social support. I don't think that's feasible over the phone. If they really wanted, and you had if the client, if there's a kid involved, like if they could do this, you could maybe do psychoed over the phone. For an adult, if they're an adult really wanting services, you could do that part over the phone. You could start to do the functional assessment over the phone if that's a fit for an adult or an older teen. You could probably start with those pieces. Another option might be, if it were going to be a longer run, and hopefully this isn't the case right now for anyone, but if we were talking about more than a couple weeks, you could think about having them check out Tick Helper, which is a sort of online self-help program. It is for a fee, but that could be something where they could get their feet wet with things. I don't know if you would add to that, Christine, but those are my general
Yeah,
thoughts.
I would say focusing more perhaps on the psycho ed and the functional assessment parts of CBIT is more feasible without doing over the phone. I would be reluctant to jump into competing response training, awareness training, because you don't want to set them up to feel like it's not going to work. And I think without the visuals, it's really hard to do. I might also use that time, if they were going to be a client for the longer term, to be talking about maybe other issues that are going on, comorbidities you could do over the phone, or even just talking about quality of life issues and all the other things that our clients are dealing with right now in terms of how to have structure when you're not at school and things like this. So I think I would shift to focusing on other clinical targets until you have that capability.
Great. So now another question I have, how do you coordinate or plan for having parents join for part of a session?
Yeah. This is a really good question. So it's good to try and plan that out in advance. Like if you're emailing or if you're doing a test session, just email like kind of what the plan is. So like if you've been working with an adolescent for a while, and typically maybe what you do, this is what I often do, I have the parent there for the first 5 minutes and then they leave, we work on a new tick, and then the parent comes back in for the last 5 to 10 minutes for social, they teach the parent what they learned, we talk about social support, and then we talk about homework. Just have that plan set. For younger kids, sometimes it's the opposite, where I'm on telehealth, I'm going to be especially concerned about sustaining their attention. I've done this with kids all the way down to 6. So I'm going to set up the plan to be, okay, maybe I'm just meeting with parent for the first 15 minutes. And kid is playing in the next room. And then kid comes for 25 minutes to do the habit reversal, like work on directly on a tick. And then we talk for 2 seconds about homework, and then I check in with parent at the end. So I think just having a plan beforehand And if you can't do it before session, doing it in the first 5 minutes of session, and then being really strategic just about who needs to be there when. I know for a lot of us in clinics, we sort of default to like, everyone's in the room. Sometimes we'll talk a little more to parent and kid will be bored for a little. It's not, you don't want to lean on that too hard in clinic, but I know sometimes there's just issues like, well, if I put the kid in the waiting room, who's going to watch them, right? And those issues are even more important to think through with telehealth. Fortunately, you can have a kid often go play on their own in their house with parent next door, whereas that's harder to do in a waiting room. I don't know, Christine, other things to add there?
Okay, do you guys have time for a few more questions?
Yep.
Okay. So during this time, some clients are going to their hometown or a different state to spend the quarantine there. I know usually the provider has to be licensed both in the state where they are, as well as in the state where the client is. However, do you know if they're making any exceptions now? And if yes, all states or only certain states? And if you don't know the answers, where could someone find that information?
My advice would be to check with whoever your local licensing board is, whatever license type you have. I know there are some states that are making temporary changes in licensure regulations, but I think it's so variable and so quickly moving that we can't make a broad statement about that other than check with whoever your local licensing board is for advice about how to manage that.
I think that's great advice. And I would add too that some states, even before the COVID crisis, do have limited practice kind of clauses. So let's say you're licensed in Florida, but you have a client spending some time in an imaginary state, because I don't want to act like I'm speaking to a state. New California, right? So I would want to look at New California's laws and see if they have a clause that says if you're licensed at a practice, if you're licensed at a state, you can practice for a total of 10 days in our state. Some states have that already. And I think it's likely that what they'll be doing is adjusting that clause in response to COVID. So look, I think one thing I would add is look at the practice board for wherever your client physically is during this time, because what you're doing functionally is practicing there.
Okay, so next question. I know this question is pretty broad outside of the current crisis we're going through, but what is the best way to find a therapist who does tele-CBIT?
I think that's so dynamically changing. Like 2 weeks ago, I would have told you there was no way I could do it, and now that's the only way I'm doing it. So my suggestion would be that the TRED Association does have a list on their website of therapists who are trained in CBIT. And I believe keeps that updated pretty well. So I would check at that list to see who is and reach out directly to ask them what their current capabilities are, because it's just really fluid right now.
Mm-hmm.
And I don't want to speak for the TRED Association, so Angela, let me know if this is off. But my understanding was that even before COVID, there was some movement towards starting to survey people on that list to see who does tele-CBIT. So that's something that in the future could be just a part of that directory. Again, I'm not making any promises, but longer run, if you're thinking beyond the crisis, that may appear.
Yes, definitely. If you are in need of CBIT provider in general, I would definitely check out our Find a Provider tool on our website, and you can narrow it down to where you are located. And obviously, since things are rapidly changing right now, my suggestion would be to call that provider to see if this is something that they are doing for now and or in the future too. Okay, so the one
thing I'll just add quickly is right now, I know, for example, in the hospital where I practice, it's a moving question as to whether we can start seeing new patients for the first time over telehealth. So that would be another question to ask, is whether people are able to start new clients over telehealth only.
Mm-hmm. Great, I think that was somebody's question too. So if you asked that about, they said, so the question was advice for using tele-CBIT with clients that you have not met in person before, so your only contact is via telehealth. So I guess that probably depends on the situation.
I can tell you what I've done in a clinical research setting and what I felt comfortable with clinically. I had a setting where folks were getting referred to me This was actually, so I was licensed in Florida, but I'm physically in California, and I was working with the University of Florida. So folks were seeing doctors who knew Tourette. They were getting an accurate diagnosis from a medical doctor. They were getting evaluated as generally being appropriate for CBIT. So they didn't have other comorbid problems that required immediate attention. They didn't have high risk for safety concerns. They were getting that, also, the diagnosis confirmed, and then kind of broadly screened and referred to me. And then I only ever saw them over telehealth. And that was something that I did feel comfortable with, and that the data from that study, though they're not yet published, suggest worked out okay. So I think the key part is make sure that you're plugged in, that they're getting sent to you from an in-person care provider who can identify Tourette and screen broadly. Then do your own assessment to make sure you don't think they missed something. These were folks coming from a center of excellence by the TAA with really well-done, well-trained doctors. I might rethink that if it was someone coming from like a non-specialist pediatrician, and I wasn't sure, but that can be a good starting point, and it can be done. The other piece is to make sure that you have a release of information to work with a provider physically in their area. So if there's a worsening of what's going on or some issue comes up, I could cue in their local pediatrician, therapist, neurologist, whatever.
Great. So that was all the questions that we have, and that's all the time that we have for our webinar. So thank you both again so much for a wonderful presentation. Once the webinar is closed, you all will receive a survey on the presentation. We would greatly appreciate it if you would complete that and provide your feedback. It is really important to us to see how successful this was and what else we may be able to help you all with. You will also receive a follow-up email within 24 to 48 hours that has a link to view the recording of the webinar. Additionally, the webinar will be posted on the TAA's YouTube channel for those who are unable to participate today. We encourage you to reach out to us about this webinar or for any other ideas and suggestions that you may have. Again, we thank you so much, and on behalf of the Tourette Association, thanks for joining us and taking the time to view our presentation. Have a great afternoon, everybody.